My name is Dr. Lauren Millette, and I am here today as a Wyoming citizen and as a physician to testify in opposition and respectfully urge you to oppose Senate File 109. I was born and raised on a cattle ranch in Newcastle, Wyoming, and was fortunate enough to go through the WWAMI program and will be forever grateful for the support from this legislature towards me becoming a physician. I am now an OBGYN, having spent the last 14 years in education and training. I tell you this because physicians are dedicated to providing evidence-based care to our patients. As a WWAMI graduate and Wyoming native, I would like nothing more than to return to my home state and provide care for the women of Wyoming. However, restrictive laws such as Senate File 109, which would criminalize physicians such as myself for practicing within the accepted standard of medical care within the scope of our training, make it nearly impossible to do so. Speaking to abortion in general, abortion is a safe medical intervention and is essential health care that improves the lives, health, and well-being of those who need it. Medication abortion is a safe and effective evidence-based regimen. Medical decisions are personal, and Wyoming places high value on the protection of an individual's autonomy. Passing Senate File 109 is in direct opposition to this belief and effectively denies the people of Wyoming their bodily autonomy, which violates long-established medical ethics. Restrictive laws such as Senate File 109 place physicians in an ethical dilemma, forcing us to choose between our obligation and oath to provide safe, evidence-based medicine to our patients and substantial legal, and in the case of Senate File 109, criminal penalties. By passing Senate File 109, this legislature would be inappropriately taking sides on a medical issue with no evidence-based justification and controlling how physicians care for our patients, counter to the recommendations of medical experts, including the American College of Obstetricians and Gynecologists. In closing, Wyoming state laws should not criminalize physicians for practicing within the accepted standard of medical care and within the scope of our training for our specialty. I respectfully urge you to oppose Senate File 109. I would like to thank the members of this committee for taking the time to listen to my testimony today.
Thank you, Dr. Questions, Senator Dockstader.
Thank you, Doctor. Is it your thought too, and you didn't touch on this, we used the word criminalization. I'm not sure that we're criminalizing the doctor, but your thoughts on if we deal with these specific drugs, that it will cause pharmacists concerns for filling those prescription orders? What do you see a ripple effect out there that, like our previous OBGYN, that could
Go ahead, Doc.
reach problems? And then, really quick, you'd return to Wyoming as a doctor? That's a closing thought, but anyway, go ahead.
Thank you, Mr. Chairman. Yes, Senator Dockstader, I agree with my colleague's previous statements. Making these drugs illegal, we've already seen that with contraception and other forms, makes pharmacists difficult for them to provide them. And as she mentioned, these are medications that we use not only for abortion, that's a small part of what we use them for. And yes, I would love to return to Wyoming and be able to provide care for the women here.
Thank you.
Further questions? My voice is fading. Thank you very much, ladies. Okay, so trade your seats with two more people who are opposed. Gentlemen, introduce yourselves. You choose who's first.